Hello, and welcome to this HISTA presentation on the Health Sciences and Technology Academy, a proven workforce development model created in West Virginia and now expanding to communities across the country. Today, we'll explore how HISTA works, how it is structured, who it benefits, and how it can be successfully implemented in your region to help solve your critical healthcare workforce shortages. What is the Health Sciences and Technology Academy, which we also call HISTA? It is a college preparatory program implemented through community-university partnerships that increases the number of high school students who go on to pursue degrees in STEM plus M, science, technology, engineering, and mathematics, with a strong emphasis on medicine and healthcare. This model is more relevant than ever. Across the U.S., communities face serious healthcare workforce shortages, from primary care to mental health to nursing and public health. Nearly every state is struggling to meet demand. HISTA addresses this crisis by preparing students to enter and complete college degrees in healthcare and STEM fields, and then return to serve their home communities. HISTA's mission is to deliver top quality STEM plus M content and support systems to high school students. The goal is to help them access and succeed in college programs that prepare them for healthcare careers in direct care and biomedical research and academia. HISTA is a 4-year program offered through local high schools or community organizations that can serve high school students. It combines residential summer camps held on university campuses where students engage in immersive, hands-on STEM plus M learning, with weekly after-school clubs held during the school year where students complete a full cycle of community-based research. Students learn the research process from start to finish, developing questions, conducting literature reviews, designing studies, collecting and analyzing data, and presenting findings. They gain academic skills in mathematics and science while developing critical professional skills, time management, teamwork, communication, and a strong internal sense of agency. HISTA programs are rooted in community-university partnerships. Universities provide infrastructure and support, while communities provide leadership through local and state governing boards. These boards set and enforce policies, oversee finances, ensure curriculum quality and relevance, and support student access to needed resources. HISTA's predictive evaluation model, built on decades of data, allows us to measure whether new programs are on track to achieve their goals and help them make evidence-informed adjustments as needed. Each HISTA program can take a general health sciences approach or focus on a specific local need, like addressing the nursing shortage or growing a behavioral health workforce. The program design remains flexible while adhering to core structural requirements. The heart of HISTA lies in what we call the HISTA R values, 7 foundational elements that shape the student experience. Let's start with relationships. Students form deep bonds with peers, mentors, teachers, and faculty. These connections anchor them through the program and beyond, often lasting a lifetime. Next is recreation. Learning at HISTA is a ton of fun. Clubs and camps include hands-on projects and activities, everything from dissections to mock investigations to job shadowing. Evening recreation at camps and daytime recreation and after-school clubs build joy, synthesis, and camaraderie. Reward. In West Virginia, students earn tuition waivers to state colleges. Other regions can offer scholarships, SAT, ACT prep, and milestone recognition. Regardless of the location of the HISTA program, students are regularly celebrated for their progress and their achievements. Next is research. Research forms the backbone of HISTA. Students complete annual community-based research projects and biomedical activities that help them master scientific inquiry and evidence-based thinking. Next is relevance. Students study what matters to them, topics that are tied to their lives and their families and their communities. This creates a personal investment on their part in their own learning. Then we have rigor. HISTA is challenging. Academic content increases in complexity each year. Students are expected to maintain a 3.0 GPA, meet attendance and behavior standards, and complete community service. Finally, repetition. Over 4 years, students revisit core skills through new projects. By their senior year, they're not only masters of the content, but they're mentoring younger students. They leave prepared for college and ready to lead. HSTA students are students in grades 9 to 12 who reside in HSTA service regions. Most are not top of the class stars. They are what we call bubble students, young people with potential who haven't yet found the support they need to fully realize it. They enter HSTA in ninth grade and stay with us through graduation. HSTA seeks out students who are curious about STEM plus M but may lack access to opportunity. These students often come from under-resourced areas, including federally designated health professional shortage areas. We don't require perfection, we require potential. Students start with a 2.5 GPA, must earn a 3.0 by the end of their freshman year, then must maintain that GPA through graduation. HSTA enriches more than students, too. We deliver high-quality STEM plus M professional development to teachers, which enhances STEM instruction for students inside and outside the program. We also strengthen local workforces by preparing students to pursue STEM plus M degrees and return to their communities as healthcare and other STEM professionals. This ripple effect supports systemic change at the classroom, school, and community level. In West Virginia, HSTA students achieve extraordinary outcomes. 99% matriculate to college, nearly double the state average. More than 90% complete a degree program, with more than 80% completing a 4-year degree or higher. 60+% of our students major in STEM plus M fields. These numbers far exceed state and national averages, and they compare favorably to other programs that offer similar student services. Further, 30% of HSTA students who finish a bachelor's degree go on to graduate or professional school. These are not just students entering college, they are young adults completing, advancing, and contributing meaningfully in professional fields. These HSTA alumni and thousands of others are now working as doctors, nurses, pharmacists, anesthesiologists, physician assistants, educators, researchers, even lawyers and policy advocates. Others serve as HSTA teachers, governing board members, donors, or mentors. Many return to work in the very communities that have supported them. The impact of HSTA doesn't end with graduation. It is truly generational. HSTA benefits a wide range of stakeholders. Students gain confidence, skills, and college access. Teachers gain content knowledge and professional development. Schools see improved student engagement and performance. Communities grow their own health and STEM workforces. Universities benefit from increased enrollment, retention, and public engagement. And the nation gains urgently needed healthcare providers ready to meet growing demand. Are you a university or college looking to build a meaningful pathway from high school to healthcare degrees? A school district seeking better outcomes for students? Or a community facing workforce shortages in healthcare or STEM? Then yes, HSTA can benefit you. We encourage you to continue this series. Watch our HSTA Hatch video, which explains how HSTA Hatch helps communities and universities set up successful HSTA programs, and our capacity assessment video, which helps you determine whether your community and university partner are ready or how to get there. You can also request a HSTA Hatch brochure and frequently asked questions list by calling us at 844-234-2899. We would love to talk with you about building a successful HSTA program in your state or region and growing your local healthcare workforce. Thank you for joining us.